It is Valentine's week. Welcome to Wisdom Wednesday. I'm Mark Sweeney, owner and founder of Austin Dental Spa here in beautiful Austin, Texas. We all know what's about to happen this week. 2 more days and it's Valentine's Day. And yet some of you out there are single and you're worried about broken hearts, and that was Al Green singing about exactly that subject. Sad to think that some people are going to spend Valentine's alone. And so today we're going to talk about the proverbial broken heart, and can it really be a serious medical issue? The answer is yes, but let me get to that in just a minute. Our theme for the month, for the whole month of February, has been Heartfelt February. There's a little bit of an alliteration in there. Heartfelt February. So we're going to talk about broken hearts today. It just seems like an appropriate subject. Is it a real thing? Well, dying of a broken heart, the chances are very small. But there is a scientific study was done, actually several of them done back in the 80s in Japan. And they found that people who had gone through a severe trauma, such as a significant breakup or a spouse dying suddenly, actually they gave it a name. They called it Takotsubo syndrome. So now you know it really came from Japan. And we'll get to where the Takotsubo came from. That in itself is an interesting little subplot. But Takotsubo syndrome is an actual real thing that can happen after extreme emotional or physical stress. Takotsubo syndrome has symptoms similar to a heart attack, and most patients who experience Takotsubo syndrome do not have the classic precursors for a heart attack. These are people that were otherwise healthy human beings. Like I said, that actually was not the 80s. It was documented in real cases starting in the 60s. Originally, these Japanese researchers thought that the main problem group was postmenopausal women, and also ones who had just lost a spouse. But now they've studied it more, and of course we've got better tracking mechanisms and MRIs and better ways to study the heart with sonograms and stuff. And they've actually found that in people with Takotsubo syndrome, the left ventricle, which is the lower left chamber of the heart, the one that's responsible for forcefully pushing oxygenated blood after it's gone through your lungs and regained oxygen and dumped carbon dioxide and then get pumped back into the body, that left ventricle balloons out. And the reason they called it Takotsubo, because the Japanese, in the Japanese culture, there's a big round jar that fishermen use for catching lobsters and octopi, and it's called a Takotsubo. So they said the left ventricle of the heart blossoms out like a Takotsubo bowl that you catch lobsters in. I thought that was an interesting little sideline here, but Takotsubo syndrome is a real thing, and they've had a chance to study it for the last 60 years now. So they said it typically comes on when there's been some kind of acute traumatic event in the person, which dumps norepinephrine into the brain, and epinephrine out of the adrenal glands. Is like when the little old lady pulls out in front of you, or somebody stops suddenly on Mopac and you're going 70 miles an hour and you have to slam on your brakes. Epinephrine gets dumped into your system and you pull over on the side of the road after you barely miss them, and then you're kind of shaking. That's the epinephrine effect. And so if a lot of it gets dumped in, the left ventricle has a lot more receptacles than the other 3 chambers of the heart for norepinephrine, epinephrine, and epinephrine. And so it's much more susceptible. And so in response, it balloons out. And so that's one hypothesis, is the Takotsubo syndrome. Another hypothesis is that the stress response is so great and so sudden that it temporarily stuns or paralyzes the heart. And then third possibility or theory is that it happens mostly in postmenopausal women, so estrogen or lack of estrogen may play a part in it. So interesting stuff. Now, let's talk about the mortality. Can you really die of a broken heart? Well, Takotsubo syndrome, as much as we've just given it 5 minutes of airplay, it only occurs in 2% of the people who seek treatment for what they think is a heart attack. Out of that 2%, which is a very small percentage unless you're one of those 2%, out of those 2%, only 4% typically are fatal. 75% of the time, without any treatment, within 10 days, they're back to normal. So they have this one major catastrophic event where they think they're going to die, they have heart attack symptoms, but 75% of the time with no treatment, they get better. A lot of medical professionals feel like you should do the regular stuff that you would normally do with a heart attack anyway, but you should seek medical care if you feel like you're dying of a broken heart. So along those same lines, with Valentine's Day coming up, we're going to talk about, hey, how can you indulge in something that typically happens at Valentine's Day? And I'm talking about chocolate. Eat more chocolate. There are several studies out there that show that there's 3 main reasons, 3 health benefits from eating chocolate. Now, dentists would say there are a lot of other reasons to not eat chocolate because of the effect it can have on your teeth. I just say brush and floss after you eat those chocolate-covered strawberries. But number 1, it increases heart health. There actually are antioxidants mainly in the dark chocolates, like they're more popular over in Europe. They actually have percentages in France of 30% dark, 50% dark, 70% dark, and that's some really good chocolate over there. But the antioxidants in that dark chocolate, the darker the better, have been shown to lower blood pressure, reduce the risk of clotting, and increase blood circulation to the heart. All 3 things very healthy for your heart. Secondly, it balances the immune system. So there are things called flavanols that are in chocolate that stimulate the immune system, and especially as we've talked about in Wisdom Wednesdays before, 80% of your immune system is in the lining of your small and large intestines. So the imbalance that might be created in there can be balanced out some by eating a moderate amount of chocolate. So on Valentine's Day, you're forgiven by your favorite dentist for indulging in some chocolate. And number 3, it combats disease. This flavanol protects cells, makes them stronger, and supports the processes that help the body to utilize insulin better, which, especially if you're diabetic, could make a difference in life or death. So those are 3 tips to help stimulate your heart. Eat more chocolate, and some interesting research about, can you die of a broken heart? The chances of that are very, very slim to none. So get out there, have a healthy, happy Valentine's Day, and I will see you next Wednesday for another episode of Wisdom Wednesday.